Good evening, everybody, and welcome to Dr. Gigi's house call. I'm Gigi El-Bayoumi, and I'm a professor of medicine at George Washington University and the founding director of the Rodham Institute, which is dedicated to improving health equity in Washington, D.C. We're about to discuss a very serious topic. And you might want to know, well, why would we talk about grief and loss and suicide around the holidays? Well, because a lot has happened in our community. There's been a lot of losses, and holidays can actually be especially difficult because people can feel isolated. There can be anniversaries. We remember the people that we've lost. Well, tonight I have my dear friend who's a guest host, Dr. Kendra Outler. Dr. Kendra is an anesthesiologist and she has a fabulous platform called Uzima. I really would recommend that you check it out because there are a number of just videos and lots of great information from everything about, the triple negative breast cancer to gun violence to mental health. And I think we'll go ahead and put that information in the chat. Speaking of the chat, please let us know where you're from, what your name is, if you feel comfortable, and if you have questions for our panel tonight. So without further ado, Dr. Kendra, I'm going to toss it to you. She's going to bring up our panel tonight. Thank you.
Hi, Dr. Gigi. Happy holidays to everyone. I want to say I want to thank Dr. Gigi, and I want to thank the producer of BlackDoctor.org, the esteemed Mr. Ellis Dean. He, of course, has supported all of our initiatives in terms of getting important messages out to the Black community. And so I thought that this was a good time to bring up the subject of grief, as there are some of us who are experiencing grief nonstop. And so tonight it is Unpacking Grief, and I hope that we can help you get through some of the most difficult days. I recently lost my younger brother, and it was a very difficult time going from 21 to 22. So we know that there've been some serious losses. And the one that I want to talk about or highlight first, but first let me introduce my esteemed panel. First of all, this panel consists of ladies first, Dr. Vanessa Freeman. Dr. Vanessa Freeman is an outstanding military psychiatrist. She joins us this evening. She is from an Ivy League university, Ithaca, Cornell. She went to medical school at the University of Miami and did her residency at Walter Reed National Military Medical Center. She is now the director of psychiatry at Fort Gordon. If I'm mistaken something, let me know, Dr. Freeman. But I'm so proud to know you as a Black female psychiatrist in this field. I know some days may seem lonely. I have also admired the work that you've done. You were also the founder of White Coats, Black Lives, if I'm not mistaken. And you also wrote a paper on the bowels of medical school, deprivation, uncertainty, and self-discovery. And I'd like to read that part. We also have our esteemed Dr. Napoleon Higgins. Dr. Higgins, I must brag, is a Prairie View graduate. I always give a shout out to my HBCUs. He went on to medical school at Meharry. Then he went to a residency at UTMB Galveston, and he also completed a fellowship in adolescent and pediatric adolescent psychiatry. And of course, it's very rare that we have the attention of an adolescent psychiatrist. And of course, this is what we're talking about. How are our children? How are they developing? COVID has produced so many issues for them. And later in the show, we'll be joined by our esteemed colleague and friend, Dr. Rahn Bailey. He will come and join us. He is the first Black chairman of psychiatry at LSU Health Science Center in Louisiana. And he's 113th president of the National Medical Association. So tonight, I think this is something rare to have three very accomplished physicians, Black or white. And we also have three Black psychiatrists. And the topic that we want to revisit our reflection is the UVA shooting. what I found with this mass shooting that killed 3 young men and wounded so many others, but that people forget that that happened. And I was questioning, was it because they were Black? Was it because they were football players? Was it because they were at a majority school? Whatever the case is, I know that those families that were affected immediately are hurting, and I want to dedicate this hour to them. Right now, I want to just call out their names. That was Deshaun Perry, who was Devin Chandler, Lavelle Davis Jr. The 2 that were wounded were Michael Hollins, Marley Morgan. We also have what I saw was the UVA football coach in tears. His name is Brother Tony Elliott. And I dedicate this show also to the athletic director, Miss Carla William. And I remember her quote during the memorial service, and she says, "I am at my limit." And if that was not a mental health cry for the community at UVA, for her personally, and all these people have families, and they have children. So while we think about what happened immediately, we have to think about how many people were affected by this trauma. And Dr. Dr. Freeman, I wanted to ask you about grief, just in a broad definition. Tell us, when we say now we're in a period of grief after the loss, what is grief in the state?
And so I should start off by just expressing that the things that I share here, the opinions that I have here, do not represent any official policy or position of the Army, the United States government, or the Department of Defense. They are my own opinions. So grief is a natural process that we all go through. It is a natural response to any loss that we experience. When we say loss, that can be death, and that can be loss of something that you had, whether it's a job or relationship or any kind of loss in general. And the grief that you experience comes in stages. And the first person who outlined these stages or phases of grief, her name was Elizabeth Kubler-Ross, and it's a model of grief. And when she was a psychiatrist and a researcher, and when she first outlined it, it was to describe the process that one goes through when they find out that they are going to die. So for example, like a terminal illness. But now we apply it to even people that are being impacted by knowledge of someone else's death, or just knowledge of some impending or pending loss. And there are 5 stages. They don't go in order. I'll start off with denial. So you may find out someone passed away. You may find out that you have a terminal illness, and you go through this phase of questioning, not believing this can't be real. The next phase that some folks go through is anger, and that's just frustration about what's happening, and that strong emotion of why is this happening? It's not making sense, and the anger can be outwardly expressed, sometimes as blame, or just sometimes as lashing out in some ways. Another phase is bargaining, and that is essentially like an if and then. So thinking, if this would have happened, then I could have saved such and such. If this would have happened, if I would have did this, then this could have happened. A different outcome than the loss of or the death of that person. Essentially, it's mental gymnastics that you start doing to try to tell yourself there's something you could have done to prevent what happened. And oftentimes there was nothing that you could have done. Another phase is depression. And when I say depression, I'm speaking of that natural response to a loss, sadness. Not a clinical depression, but just a sadness of that loss. And sometimes that sadness can last for a long time. It can last sometimes for years. And if it goes on to a point where you're starting to maybe lose weight, starting to not be able to eat, or starting to completely withdraw or become isolated, that's when it would be considered a clinical depression, and you would need to reach out to a therapist. And the last phase is actually acceptance. And this isn't saying like, oh, I'm over it. This is more so saying, yes, this happened. This was a loss, and I'm accepting it happened, and I'm living with it. I'm living with the knowledge of this loss, and I'm also being able to move forward and experience joy or experience other things outside of the grief. So I tried to summarize that in 2-3 minutes, but that's pretty much the phases that one can go through, and you can bounce back and forth. You can go through it, and it's really, it's a wave. Sometimes you're not feeling that grief at all, and then all of a sudden, Dr. Gigi mentioned earlier, like an anniversary or some kind of reminder pops up, and you feel like, oh, I'm angry again, or that sadness is back, or another one of those phases is back. But that's essentially grief.
Oh, I got it. That is essentially, why the new year, can bring about profound grief, and people start to do certain rituals and things to remember their loved ones, light a candle, say their prayer, or visit grave sites. So we want to recognize that for others, and for all of us, there may be something that we're doing to remember people who've passed on. I was looking up the shooting, that the UVA shooting, and they did a story on that recently in the Washington Post almost 3 days ago. And what was striking about that was it was just the talk of it, the incidents, the events, right? And so, Dr. Higgins, I'm going to you because one of the comments either on YouTube or what have you is the why. And this was, and I also saw a comment that said that one of the students said, it's very difficult right now to be a student, a Black student on this campus. And so while we don't want to make this all about race, in my mind, I said, this is about race and how our Black boys are perceived. And here we have a number of them esteemed, doing something that we all want our kids to do, go to college, go see a play, ride back on the school bus and arrive safely, And so the person that did this horrific crime, and I'm going to say his name, although people have not, he is somebody's child. His name is Christopher Jones, was on that bus feeling angry or what have you, or having some type of emotion. But there was no way to predict that. And so, Dr. Higgins, I know that COVID has taken a particular turn on our children and a toll on our adult children as well. And as a psychiatrist that focuses on that period, I want you to weigh in on what you think what our youth are experiencing, and some of the knowledge that you have when it comes to adolescent emotions of maladaptive things like depression, anxiety. So the floor is yours, Dr. Higgins.
Well, that is a lot to cover,
Yes,
and what is going on, realizing that it's multifactorial. It's not just one particular thing that's causing this. But if you look back from Dr. David Satcher's report on mental health and looking at African Americans, and you'll see that Black teenagers have had an increasing rate of suicide over the last, say, 20 years.
Mm-hmm.
And really what we're looking at many times in these situations is a homicide before a suicide. And if you notice with all these mass shooters, there's never, even if they write a manifesto of what they were going to do, there's never a what I'm going to do tomorrow. So whether you complete a suicide or you throw away your life, normally it's the issue of you're taking lives before taking your own. And I think it's one of the part of it is just a matter of suicide and other mental health issues that may be going on. So when you ask the question of why, we have to look back over the last 20 years to figure out why. And then we also have to have a long-term plan on how do we prevent these from occurring or continuing in our country and in our society. So one is the availability of guns and how lethal they are. Mm-hmm. We have more guns in America than any other country. Mm-hmm. And we have this thing where we believe that we can solve problems and issues if we've got more guns on top of guns on top of guns. And if guns were going to solve America's problems, then we wouldn't have a problem because we have the most guns. And really what we're seeing is the most gun deaths from anywhere around the world. I was recently out of the country, and a person mentioned that that in their country, there is no knowledge of the possibility of having a mass shooting where someone shoots and kills several people. And actually where I was in Egypt a couple of weeks ago. And it was like, as much as people talk about the Middle East, we don't do those kinds of things. So we have to look at this multifactorially. But the issue of the losses that our students have had, especially over COVID, are another independent issue that we have to look at. And that with the shutdowns and the need to protect ourselves, especially before masks were available and vaccines were available, we had to do this hard shutdown where a lot of teenagers and young adults during a formidable part of their lives were without the ability to communicate, to talk with others, and everything changed and switched so quickly on them. And so when we talk about the issue of grief and loss, you've got a generation that's hit all kinds of grief and loss over the last 2 years, outside of just losing a loved one or threat to your own life. But imagine what all is all switched and changed, especially at a younger age when you haven't seen a whole lot of life occur. So this damage that we're seeing, I expect to roll out, over the years, and what we're seeing is going to be a problem over time. So, with the young man and the loss of life at UVA and it not being covered by the media, as we've stated before, many times, Black Lives Matter. And these kids deserve as much coverage as anywhere else. But in our country, we tend not to do so. Now, I would also be careful of where we say it's not covered, because I know in the Black community it's covered. All right. But I'm not looking for them to cover us like we would cover us.
Okay.
But too often we don't get to hear our news,
right,
what is impacting us, as an individual, as a group of people in this country. But peace and blessings be to the families, and may God give them, console them and help them through this journey, because it's unimaginable that a tragedy like this would happen. And people would say, why this person? Why did this person do that? And I would say, no one really knows why, but we have a lot of hints. I know Dr. Bailey has written a book about gun violence, and I'm sure he could share more of that with us.
Okay. Thank you, Dr. Higgins. And again, I know I'll be coming back to you as well to dig a little bit deeper into some of the, behaviors that our adolescents are dealing with and struggling with right now. And I would like to welcome back Dr. Bailey. Again, I've introduced him. He's our chairman of psychiatry at LSU Health Science Center in New Orleans. New Orleans is having a gun violence epidemic, and he is at the frontier with them to try to curb that. Dr. Bailey, again, we're reflecting on the UVA shooting. We're not trying to say that was the only mass shooting, but I felt that the coverage was lacking. What I find is that sometimes we're going over details, but we're not getting to some call to actions, some better explanations, some meaning and interpretation of this. And so that's why I gathered everyone here tonight to try to have this talk. And of course, we want to recognize that these families are grieving. I will say that the Perry family and the Hollins family have issued a call to action. And that is also why I decided to do this platform, is because they asked that we have more mental health awareness, and we also engage with them and help them uplift the message about anti-violence and gun control. So Dr. Bailey, written a great book, At Gunpoint. I've used it, referenced it a number of times. So I want you to talk about two things, gun violence, and we also need to talk about acute trauma, which is something that LSU is dedicated to addressing in the New Orleans area.
Well, thanks for having me, Dr. Outlaw. I certainly enjoyed joining this panel. I think the comments are being made have been outstanding. So I had to look toward my Wi-Fi, get it back on. So thanks for your patience. I pick up what Dr. Higgins made the point as I was coming on. The reality is the coverage, I think, does exist, but it's in pockets. And that's been really the history, unfortunately, for Black Americans throughout, during my career, throughout much of, I think, our country's history. The negativistic history very often is promulgated, I think, extensively when it's an adversity, I think, all too often toward young African men, but not of the humanistic side, which I think, Dr. Outlaw, you actually kind of point out. That's sort of been my experience, I think, with the issue of the UVA circumstance, as well as others. I also think the issue regarding gun violence is a relevant point. I think that's key statistics that I think everybody should be very mindful of. There are probably about 12 gun violence-related murders, I think, in our country per 100,000 across the country. I am in New Orleans now, as you mentioned. Unfortunately, we probably are number one in the country, probably at about 14 times that overall rate. Other places I'll often make the comment about Chicago are probably at about 3 times that rate. And we hear a lot more about Chicago and how about the gun violence is there compared to other cities. So the political aspect and the politicization, I think, very often of the gun violence concern adversely affects all of us. We don't understand it well, and that prevents us, I think, very often from moving in a systematic process for considering what type of strategies we all can engage and employ, whether we're professional or lay people, to work to, I think, decrease and eliminate, I think, this problem, I think, over time. I think the issue regarding trauma that you describe, I think, is timely. The reality is there's a remarkable amount of psychological baggage and emotional trauma. I think psychological deficits that I think exist continually in the lives of many. If you live in a setting where you think there may be some risk of gun violence to you, of course, you're a lot more likely to be hypervigilant, always on guard. That has to take a fair amount away from your ability to function optimally, whether you're a student in school, whether you're a parent taking care of your children, whether you're an adult working a job. I work at LSU now, as you point out, and it's been shocking in my first year and a half there on the ground in New Orleans, how often we get a daily alert. And this happens, I bet, on average at least once a week, where there's been some kind of a violent or near violent crime within our 20-block, I think, diameter. So theoretically, because we're an urban campus, the city major streets run right through us. Canal Street, everybody kind of knows about it because of the French Quarter, runs right through the middle of LSU's campus. It changes the way you think. It changes the way you function. We advise actually very often you're walking across campus to ask for security to assist you during the daytime now, if you're a faculty member. So it's really begun to change. They hired a new security person. I think they've increased about 50% the amount of security during the daytime. So the reality is these issues, if they're affecting us at the professional level and in a healthcare setting, imagine, I think, how deleterious they are to many, I think, Americans in settings where you don't have neither those kind of resources and not that degree of support in that setting. So a lot can be said, I think, about issues regarding acute trauma that many of our community, I think, struggle with in this regard. We cannot do enough to provide the kind of support and tangible benefits I think they need for a professional setting to help them kind of get through this psychological risk.
Mm-hmm. And if I could just add, because Dr. Higgins, thank you, Dr. Bailey. Dr. Higgins made an important point about the fact that there are pockets of media that's covering it. But when mainstream media doesn't cover these issues, that is sending a very strong message, especially to young people. And that is that you don't matter. And part of the issue around depression and suicide and anxiety is alienation. I don't think we talk enough about that. Mm-hmm. If there is hopelessness and kids don't feel, young people don't feel that there is a path for them, then it's going to be difficult to help their mental health improve. Mm-hmm. And I don't think that actually gets enough of the discussion. Mm-hmm. Young people are alienated, mm-hmm. and this has an impact.
Well, I think that, Dr. Higgins, I want to go to you in terms of we're using social media for information and entertainment. And I think that, can you comment on the impact that you as a psychiatrist feel that using social media as a form of communication and outlet is having on our children?
Well, I would say there's the good and the bad. And what I'll say is the good part is, especially during the time of the pandemic, where people couldn't physically be around one another, social media was an outlet where people could speak and talk and communicate on multiple levels throughout the different, social media platforms. But also it allows us to make our own news as Black people. So if the mainstream news, if CNN, Fox, or even our local affiliate is not covering information, we're able to cover that information on our own, realizing that many of the, Trayvon Martin and all the other stories that came out after that were stories that came out of the Black community through social media, which was later picked up by mainstream media. So those are the positives. The negatives about social media, though, is that many times people can hide behind information that they're putting out that, they can say whatever they want to say. Also, we're looking at the issue with one of our social media platforms, I'll just call it as it is, Twitter, where the personnel has taken over. And when I go on Twitter, I keep seeing racist, social feeds. So it's not like everybody's racist in the world. I know good and well I don't click on racist stuff, but I'm getting these feeds constantly saying things negative about Black people, or using bad words about Black people, or having thoughts that are not even within my own. So when we look at social media, these social media companies have the ability to put certain things into your social media feed and make it seem as if this is what everybody is doing or thinking, and it may not be true at all. But the last thing we got to look at is the social media and also the music that we listen to, and the videos, and how Black people are portrayed. A lot of Black people, and I would say especially for our youth, can be very much influenced, including us as adults, but also the issue of this, if you listen to the music that is coming through to our people, understand that 95% of the music that you hear on the radio and videos that you see and things that you hear on XM are decided upon by white men. 95% of all the music that you hear in the Black community is not organic from the Black community. It's decided on by white men. All right. And you hear these stories, the way they talk to one another, the way they're talking to you, these rags to riches, where, just 2 years ago, I was broke at my grandmama's house. Then all of a sudden I'm riding, and I got all this, and I got all these women, and the way that they talk about our women, the way they talk about themselves, that was a song calling people, the listener, you Lil B. All right. So you are an entertainer talking to your listeners, and you calling them all little B's, and you're referring to the men, not even to not just the women. So if you listen to the music that they're listening to, it sells something that is not true in the world, and it does not fit your life, but it's supposedly what we're supposed to look up to. And I find that a lot of our students are getting lost in this information and getting a lot of bad information, and it does not fit real life. So a lot of people believe that these things are supposed to happen this way, and they just don't. So the what we're putting in front of our students with the social media, in front of our college students, and I'll just say it like it is. This whole thing about marijuana, oh my goodness. How many students truly believe that marijuana helps everything in your life, no matter what's going on? And I tell families, this is not the weed that we smoked back in 1990 and 1980s. It is something completely different. I think they should call it something else because of the potency of what's going on and the changes that you see to these children's minds, especially as a young adult, because the younger you are, the more impacts and the lack of predictability that you have on how it's going to impact you. So these multiple streams of information is coming into our families, into our homes, through their phones, through their computers, through the radio, through the internet, Spotify, Pandora. All of these things I believe are impacting our youth, and we're not really getting good information to our young adults and to our children. And I think that a lot of them end up lost, not finding that they have a way. And then if you find, with loss comes despair, and despair, hopelessness. And then at that point, at a certain point, my life is not working out correctly, the idea of suicide, but realizing that if I don't care about my own life, what do I care about your life? Mm-hmm. All right. And one of our colleagues who passed right before the pandemic, Dr. Carl Bell, always talked about we're focusing well too often on the homicide, but really you're looking at trying to prevent the suicide, because it's the homicide that is before the actual suicide, where a person does not care about their lives.
I think that's a very good point. And this might be what this is the best summary of the why in the shooting at Virginia, that this young man had stopped caring about his life. And, without any clear diagnosis of delusions or what have you, that may, that really is what happened, that he didn't care about his life. And this was this preceded him taking his own life, which in effect he did. And there's the book called Lay Down My Burden that talks about suicide and talks about exactly what you said, Dr. Higgins. And I know Rahn Bailey knows this book as well. That we talk about how Black youth and Black people may commit suicide. They call it death by cop, or death by, doing something like killing other people and then in effect annihilating or ending your life. And so, Dr. Freeman, I know that you're speaking as a psychiatrist, a civilian psychiatrist, but I know in your work you understand gun violence, and you understand suicide. So we have so much to unpack, but I'd like Dr. Vanessa Freeman to talk to us about her perception of this suicidality.
Yes, and I think Dr. Higgins highlighted the hopelessness, or maybe it was also Dr. Gigi as well, but you all have already mentioned the hopelessness, the despair, and getting to that place where nothing seems like it matters, nothing seems like it'll make a difference. And so people can get to that point where nothing is for them or nothing is there for the future. And so that becomes the logical solution. And so people can get to that place. And I pulled up some statistics from the National Institute of Mental Health from 2020. So this is very recent information. Suicide right now was the 12th leading cause of death overall in the United States. Suicide was the second leading cause of death among individuals between 10 to 14 years old, third leading cause for individuals between 15 and 24, and the fourth leading cause of death amongst those that are aged 35 to 44. So this is a big issue that we need to be addressing. Later on in the statistics, it mentioned that over 12 million people had thoughts of death. Thoughts of, not just thoughts of death, that's morbid thinking, but more of thoughts of killing themselves. 10% of those people who had thoughts of killing themselves actually attempted. And so there's steps of getting to that point where doing something that final becomes like a reasonable option. And so that's the thing, you know, we can talk about it now after the fact, especially with, for example, Twitch, right? Twitch just passed, and that hit a lot of people really hard. And so when it happens to a celebrity like that, who someone saw all the time dancing on Ellen, doing everything, smiling all the time, nobody knew really what he was going through on a daily basis. But when something like that happens, or I think maybe in January of this year, someone else also died by suicide.
Regina King's
son. I forgot her name right now.
Regina King's son.
Yes, and then there was another person who was a media person. Then she also was a Miss America, I believe. Yes. I might be, yes. So right. She passed as well. And so that's a time where everyone starts thinking, what do we do? How do we prevent this? What happens? And so I think I'm glad we're having this conversation. And the thing is to identify those signs and those steps that are happening, or that thought process that is happening leading up to that final action. And it's that hopelessness. The challenge, though, is that sometimes we can't see that. Sometimes there aren't signs. And so the thing that I've even told people around me at work and friends even, you know, the thing is we need to carry ourselves with compassion, carry ourselves as if everyone around you is going through something, because you really have no idea what anyone is going through. But carry yourself with that compassion. Recognize that we actually have no control over anybody but ourselves. So going back to that grief that I was talking about at the beginning and thinking of that bargaining, if I did this, then that, we can't fall into that trap or that myth of, if I had said this to this person, they would not have taken their life. So we can't take responsibility for actions that other people do, but we can be compassionate, be nice, be kind, and be genuine with people, because we really truly don't know what they're going through. We don't know when somebody's to that point of hopelessness. So that's what I would say. Just encourage that, especially with caring for other people, and that reflection for yourself, so you can see if that kind of thought, or that kind of, what I tell people, is like a soundtrack in your mind. You start noticing that soundtrack is changing. It's a little dark lately, or it's a little bit silent. That might be a time to start reaching out to somebody and talking to somebody about.
And if I can just add, Dr. Vanessa, because I think your point is so important. You know, I am of Egyptian heritage, Dr. Higgins, and one thing that is true in Africa is that when somebody sees you and you're not yourself, or even sometimes people just in the street, they'll say, "What's wrong with you?" Right? I mean, in South Africa, the way that you say hello is, "I see you."
Mm.
So I think, because of how society has evolved, because of, I believe, the deliberate dismantling of African American communities, all of those sort of safeguards and ways of kind of checking in on each other have really, really been eroded. To your point, Dr. Vanessa, I cannot tell you, when I take care of adults and I take care of a lot of people who struggle with mental illness, they will often point to one person saying something positive that got them to change their mind. And
Mhm.
so sometimes when we're thinking about the solutions, we say, "Oh, we've got to get everybody through mental health training. We've got to get people to increase the number of mental health professionals," which is all true. But kindness, for heaven's sake, noticing when somebody,
Mhm.
whether that's the person in the checkout, the cashier, or the person serving you coffee. I saw a young man today giving coffee, and I was like, "What's wrong?" "No, no, no, no." I said, "There's something wrong with you."
Yeah.
That is our humanity. I think it's very important.
Thank you, Dr. Bailey. We had a discussion before, and thank you, Dr. Gigi. We had a discussion before because we all want to be compassionate. I know, we have good days and bad days. We all do. We all, I mean, after I suffered my own personal loss of losing my brother, I've had more bad days and could not even verbalize kindness or speak because I would be in a ball of tears by the end of the day. So, if you're going through, challenges, loss of job, like we discussed, we all have them. Even, for instance, academic achievements or athletic achievements. And Dr. Bailey, you eloquently described these maladaptive, when do things become what we call maladaptive? Because that's the only thing I can think of, is that when we get to the point where we think, like Dr. Freeman is saying, Dr. Higgins is saying, where there's no hope, or let me listen to what the radio's saying a little bit and get some of this negative energy in me going because it makes me feel like Superman. And you start to distort reality. So can you tell us about, the process of maladaptiveness?
Absolutely. I think as you point out, I think many of you guests today have hit points that I think are really right on target. I think we clearly describe the term clinical depression, I think, in organized medicine, in the vernacular, as a diagnosis. I think with a formality. Many individuals, many Americans tend to think that anybody can be depressed. Any type of thing can actually happen. But I think there's actually more to this entire issue. Whether you're a psychiatrist, psychologist, or professional in any setting, it's our responsibility, I think, to have a very high index of suspicion, to really look for it and really think about it. This concept, I think, of what's maladaptive is a term of art, I think, in our profession, addressing, what's normative for individuals and how we typically adapt, how we respond to, I think, challenge and change, and psychological deficit or difficulty is abnormal, and you're not able to do it in a typical fashion. If someone dies, for example, and you made the heartfelt comment about a relative. I had an uncle that died of COVID myself, one of my godfather, here about a year ago, up to 6 months. It's normative to have clinical depressive symptoms. We call it bereavement. It's not normative to have that past 6 months, because we generally have these adaptive measures, these so-called coping mechanisms, these defense strategies that help us kind of get through it, help us kind of grow emotionally and work to a point where we can actually understand and manage. I think what we're seeing, I think, in our community, in many settings, one reason why there is so much violence and gun violence particularly, is that many in our society, our collective maladaptive orientation. We think that the way to respond to difficulty is more. It's not effective to respond to violence and more violence. Everyone loses. We also tend to think very often that we can just ignore, that we have to find ways to grow, to get better, to get stronger, to protect, I think, ourselves and our families. When we lose, I think, that subscription and that concept, I think we actually move toward a model of hopelessness and carelessness and a carefree attitude. And that's why we see persons who, I think, engage in behavior. I love your term earlier, Dr. Outler, about suicide by cop. The reality is, if you walk toward the cop and you have a gun in your hand, we see these cases, unfortunately, periodically in these settings, you're going to lose, because they are hiding behind a metal car and they have armor on. But I think psychologically what you're saying is, I don't really care if I lose. It's better to be dead than alive. And I think that's kind of part of the description that I've seen in my career as a forensic psychiatrist, where persons don't mind being arrested and going to jail. If the idea is that it's actually better to be in jail or prison, either because you have your basic needs met, 3 hots in a cot, healthcare and food, or if you will, or safety, that's not how society is geared to work, whether it's democratic or civilized or otherwise. So a lot's being said, I think, in communities where I think there's this overall collective construct of being clinically depressed. Because of that, many individuals engage in behaviors that don't make sense to us. They are, as you point out, maladaptive. They don't work toward protecting and engaging in actions that help us actually grow and prosper and I think persevere. They actually move toward causing us to have more risk and more greater likelihood of an adverse outcome. And in that setting, I think that's an unfortunately perfect storm for the recipe of violence. I'd also say that, violence, I think, very often is duplicative, I think, in our society. All too often, someone wants to respond to a minor provocation with what I call a major or a severe ending engagement. You step on my foot, I want to kill you. You insult me verbally, I want to shoot you, things of this nature. This isn't incidental. This actually comes out of this entire subscript. If society has for a long time treated many individuals who are Black and brown, who very often are poor or lower SES on issues that matter in America, how much money you have, or power, or wealth, or influence, very often you incorporate and ingratiate yourself toward that theme, and you engage in behaviors that I think continue to perpetuate, I think, that negative activity. We have a lot of work to do, I think, in our profession to get the point out, the message out that people are valuable, as one of the other panelists mentioned, that their lives do matter. And I think every single signal that we send must, I think, change in that regard. Otherwise, we're going to continue to see negative response, very often a violent one, an excessive violent one, to, I think, provocations that should have been handled, I think, with conflict resolution, what we can say rather than what we can do. What we can do, I think, promote people and promote their value. We don't have that increasingly now, I think, in our country, and it's hurting us greatly.
I agree. I think that right now, Dr. Gigi will look at some of the comments, but I want to read something that I found, a quote about grief, and it said, "There is no grief like the grief that does not speak." And so we are trying to speak about grief so that hopefully we can promote healing in our community on some level. And so we'll look at some of the questions and we'll go to a second 20 minutes of the show to close out and get some solutions that I've seen out there discussed, whether they're effective or not. Do you see anything, Dr. Gigi, that we need to speak on?
Well, the comments have been overwhelmingly positive, and people have really appreciated this conversation, a long overdue conversation.
Okay.
So I think we can continue on. And yeah, can I start off by just saying one of the solutions? So what we recently had at Rodham is an intergenerational conversation with young people and seniors. And what was so helpful is that the seniors were able to share their difficult times when they were teenagers, to give sort of that perspective. As Dr. Higgins mentioned, the developing adult or adolescent brain still does not have enough experience and also physical maturity to, sort of say, well, this too shall pass, right? Where that's why I think it's so important to get intergenerational conversations and involvement. So.
I think that's a very good point. We have to remember again that we've had some disconnect, one because of the pandemic. And of course, our elders who were frail or afraid of getting sick really withdrew. And it was we almost missed 2 cycles of family get-togethers that we allowed to see a great aunt or, even our grandmothers. I have an aunt in New York I need to go see and check on. Because again, part of the holidays was getting together, talking about old family stories and feeling connected. So that is real. And I think that we have to get back to feeling connected with each other and talking. Also, in terms of solutions and your specialty as psychiatrist, and all 3 of you, I'd like for you all to take 1 minute and weigh in on this, the ability to see patients remotely. Your practice has changed, your volume is up, but the way that you are delivering mental health care, our mental health care system is being now forced to deliver it differently. And so really quickly, how are we doing with that? Because there are a lot of platforms now that say, dial 1-800, reach out to me, or you can find a mental health person. And I'm finding that when you go to these platforms, they get your information, but they don't necessarily connect you to a mental health person. So are these gimmicks? So I don't want to keep going on, but I was really disheartened. I played with a couple of them, and I'll be straight up. It was the one that they boasted about with Megan Thee Stallion. I went through, and I couldn't find. It took the information, but it did not match me with someone, you know. And when people are in crisis, they need to speak to someone. They don't want you to gather their information. So we have to be careful about uplifting these platforms. So can you tell me, you know, from your as leaders in this field, what your thoughts are? I'm sorry if we could go around the room. Dr. Bailey?
Yeah, I'll jump in. And 1 minute or less, I'd say three things. One, first and foremost, psychiatry is real. Mental health is serious. These issues, I think, have tangible and organic adversity, I think, in people's lives, and it can actually lead to, you know, morbidity or disease and even death or mortality. And it's remarkably unfortunate when many think that all we do is kind of talk to people. It kind of devalues, I think, a lot of our training and our experience. And it certainly, I think, undervalues the reality that to the individual who's a patient, who's an individual who's hurt or harmed, that it really matters to go out and seek this care proactively, I think, in advance. That's the first thing. Second, I think that, you know, training does matter. And our engagement of being what I call culturally competent also matters. Being able to hear somebody's story and share, I think, an articulate and a timely and a heartfelt message, because you actually have walked in their shoes metaphorically or theoretically. You actually understand at one level or the other what they're going through. Really helps you, I think, make the connection that I think is so important, so-called therapeutic alliance in the doctor-patient relationship that I think is essential in the therapy, I think, of psychological engagement and psychiatric care. If you don't do so, you certainly substantially limit your likelihood of being able to really help them in a way that's pragmatic and really and practical and really matters. And the final part, I'd make the argument, I think that we have to regularly, I think, make the argument that people should actually go for care in advance. We shouldn't wait until it's end stage or tertiary once you're in the emergency room. I've said throughout my entire 32-year career now, when people regularly say, whether it's, you know, national television or in regular local conversations, that Black men, for example, don't go to a psychiatrist, I always want to laugh, because I can't get them to stop talking to me. And it's been my life. We just have to create a setting where for that individual, what they say matters. They have to kind of hear you, and you have to give them, I think, some practical, valuable takeaway messages that they can actually use to improve, I think, some of the components of the quality of their lives. So I think you make a tremendous point, Dr. O. These issues are important, and we should do a much better job emphasizing them, even moving toward an era where we have more influence on policymakers that can also, I think, go a long way toward funding the programs that I think we represent and support.
Yeah, I'm just going to culturally appropriate counseling is very important, and I agree. I'm not going to belabor because I want Dr. Higgins. Give me your thoughts, Dr. Higgins.
Yes, definitely. So since the pandemic started, I've been telemedicine 100% since March of 2020. The last patient I saw was someone who swore they were going to wear their mask and then didn't. So after that, I was done seeing patients in the office. Plus, I have a lot of elderly individuals in my office with a lot of medical conditions. But one thing that I would say is that it's expanded my practice, and that when everyone had to come in, essentially, Houston is a very large city, only second in size to Los Angeles. So I had a lot of Black people in the city who couldn't get to me because it was just too far to drive or too far to go. But now I have more Black patients because they can, you know, it doesn't matter exactly where you are. So I have patients in Houston, I have patients in Dallas, I have even some as far as El Paso. So now I'm more accessible by being online. Now, I do have a few people who would prefer to see me face to face, but honestly, I've not seen any loss in clinical care outcome by doing it by way of telemedicine. So it allows more people to get in to see me, even, you know, my rural folks and things of that sort, down towards the valley who had to drive 4 or 5 hours. They don't have to do that anymore, so it's a lot more accessible. And then really, as Rahn Bailey had already talked about, the issue of cultural competence. You know, I have a fair amount of Black male patients. They love talking to me, you know, so I don't have a problem with them opening up to me, but it's an issue of who do they open up to, right? Realizing that 2%, some would say as far as 4%, some would say less than 2% of all psychiatrists are Black, when 14% of the population is Black. So the need to find those culturally competent individuals. And one last thing I'll mention about that is Black people have better outcomes with Black doctors.
Especially psychiatrists. I will say that, especially psychiatrists too.
Every time that they do a study on outcomes, Black patients have better outcomes with Black doctors versus white doctors. And so these fears that we have are really true. You know, it does really impact how well you're doing. And so we have to be culturally competent. And one thing that we're working on, as I'm executive director of the Black Psychiatrists of America, we're working on a Black psychiatry directory. And so we're including Black mental health professionals of all sorts. We've covered Harris County. Next, we're trying to bring in Los Angeles County. And then we're looking at Atlanta and then North Carolina. Those should be online in the next 18 months.
Okay. Yeah.
So I'm not ready to give out the website quite just yet.
Right.
But right now it's probably the largest directory out there. We're still building a lot of things and still working out the kinks. So I don't want to send someone somewhere where it doesn't work right.
Right.
But we do find that some of these companies who want to create these directories for Black people are really data collection companies,
right,
that have not a big interest in actually delivering care.
That's right.
It's about collecting data and information. But with the Black Psychiatrists of America, our intent is for it to be Black owned and for our people. Right. Well, too often, if we got something going well, it goes to somebody else and their interest is not us. So, you know, I can mention some media organizations like that right now where I find it to be irrelevant to me and my lifestyle and what I do. So we have to make sure we're looking out for that as well.
Another resource that I want to bring up, I'm on the Tribal Advisory Council for Boris Henson Foundation. That's Taraji Henson's foundation. And they have not only psychiatrists, but psychologists, and they provide 4 free sessions.
That's great.
So that's another potential resource, and that's national.
Dr. Vanessa Freeman, do you have any thoughts on telemedicine for
psychiatry? No, beyond what's been shared, ease and accessibility. I'm not really using telemedicine at this time. When I was, that's the main thing that I noticed from patients that they mentioned. This is so much easier for me. I'm able to get here. I don't have to drive. And that was when I was in DC and traffic there is terrible. So they appreciated that. And I would say for those out there that are looking to find a provider, look at this as you're shopping. And so just because that's the first person you hooked up with, you don't have to keep them. If you're not clicking, go on to the next thing. And I would also say put out a few different requests so that you at least have backup. So like Dr. Bailey said, don't wait till you can't wait. And so then when no one's working, it's worse because you're in a really bad situation. So put out like 5 requests at the same time, and at least you'll get 1 to 2 hits back. And then you're more likely to hopefully get a connection with somebody.
So I thank all of y'all because I think that's important. Everyone made a great point, and also sharing new platforms, the Henson Foundation's platform for accessing mental health and the fact that it's free. Because let me just say that a lot of mental health care is not free. And someone said, don't forget your mental health nurse practitioners. We are talking about all mental health providers. If we did not say it specifically, oftentimes the Black psychiatrist is why we brought you here this evening to let, I feel like this was your time to let people know that you are in the field, that we are, like Dr. Higgins said, 2% of the mental health providers out there, and we do feel strongly that cultural competency matters. And I work with all of you in some capacity, and I just know that you're the best of the best. So I wanted to make sure that because people say Black people don't go to the psychiatrist. We're afraid of the psychiatrist. We all know there's some history there about asylums and people being taken from their families. But we also want to know, I'm glad that you highlighted Dr. Bailey and Dr. Higgins, that no, they come to me and they talk. And so as individuals, Black individuals who need crisis intervention, who are at their limit, if they can get to a psychiatrist and get to particularly one that can relate culturally, they'll end up with a very good outcome, or prayerfully a better outcome. I know that our families are expressing grief. I had one quote, and that was that there's no sorrow that heaven cannot heal. I cling to that during my time. I'd like to, the last 4 minutes, if someone else is, wants to give a word of encouragement to the families, please do, and I'll go around. I also want to make sure that our audience look for their families. The Hollins and the Perry family have a platform and GoFundMe pages. And so please give to these families that are out here. And it doesn't have to just be from the UVA. It can be from any family right now experiencing loss. I got one for GoFundMe for someone who was a victim, families where the children are left parentless due to domestic violence. So I'm going to donate. So please understand that that's also a way to just feel like you can do something. And that is a solution. So if anyone wants to give out a word of encouragement to families experiencing grief, I'd like to open the floor. Dr. Vanessa.
I would like to add, I heard this quote on an actual Marvel TV show, but it said, "What is grief if not love persevered?" So essentially, grief is the love that you have for the person that continuing to persevere despite the loss of their physical contact with you. And one thing I always remember is that grief is going to be, the pain is going to be equal to the love that you had of the person. They're equal. So I count it all joy. So I miss my mom every day. I miss my eldest sister every day. I have friends that I miss on a regular basis. But I count it all joy because of what type of love they put into me, that I think about them all the time. So I count it all as part of the love process that we have for individuals who are no longer with us. And I am thankful that the pain is so much that they meant that much to me to have the pain.
Thank you. Okay, Dr. Bailey?
Yeah, I know Higgins' mother as well, and she was a wonderful person. She loved baby boy a great deal, so I can understand what he's saying. A tremendous quote, and I think a timely one, Napoleon. I think one that I think resonates with all of us. I'd say three things to ending. One, I think somebody mentioned in the chat about the 988. We should always mention that there's an attempt now increasingly to make it easier to access care and resources. Rather than thinking, you only wait for do 911 when there's an emergency and a gun needs to be involved, 988 for a suicide hotline will go a long way. I'm actually very proud to say I've actually been on this SAMHSA National Advisory Board for the last 2 years. I got a 4-year term, and we're working on a new issue now that I think will also be relevant, I think, for the African American community. So I think when we have access to, I think, resources, boards, for example, advisory boards, we should always be thinking about what's not only culturally competent, but what's, I think, community relevant for our community to create resources that I think are likely to work and likely to matter. I'd agree with Dr. O. I think the point that we should say something that I think is very heartfelt to families who've had loss matters. So I'll end with the comment that I think we always discuss on these kind of venues. That's the issue of stigma. We all can do a better job acknowledging and being the reprehensible nature, I think, of stigma. It makes people afraid to go for care, afraid to acknowledge some degree, I think, of deficit emotionally. If you have a deficit with your health, if you got diabetes or cancer, or asthma, people feel sorry for you and they bring resources, emotional, I think, and financial, to support you. We should do the same for people who have brain-related disorders and illnesses such as clinical depression, ADHD, dementia, I think, or panic disorder alike. Not doing so, I think, it has a very tangible role in hurting people who need care from getting it. And all too often that has a disproportionately adverse effect in the Black community. So we should all, every chance we get, say something to undermine the scourge of stigma, because it hurts our community. It decreases our chance to get quality health care.
Thank you. Dr. Freeman, you have some words that you want to share to our listeners that's heartfelt?
Oh, yes. Just a reminder. One thing I want to emphasize is just to tap into the support system that you have. Tap into the folks that you are with, that you trust to be open with, and practice vulnerability and transparency. Those are hard things to do, but tap into the loved ones that you do have. If you're grieving, tap in to who you have with you so that they can carry you and help you get to a place where you are feeling like you're back to yourself. And I also want to emphasize what Dr. Gigi said, which is that the I see you, but it's that compassion. Mm-hmm. Be compassionate to yourself and to everybody around you.
Dr. Gigi, thank you.
Well, I just want to say that everybody that's listening and people that are not listening, you matter. You matter to me personally. I have not met all of you, of course, but you matter. You are all important. And speaking of the stigma, so many people, feel embarrassed or ashamed. So I'm going to just tell you, I had depression. I went on medications, life-saving.
Mhm.
Therapist, life-saving. It's an illness just like anything else. There's no shame.
Mhm. Thank you for sharing that. And that is something that needs to be shared. If you have experience where you definitely needed to have medication, or you need to see a psychiatrist, or you need to just share with someone. And what everyone says mostly is that the isolation that happens when you are becoming depressed, or you need some mental health intervention. We talked about depression. We all know there are people with bipolar and schizophrenia in the Black community. We can have a whole series and what have you. And from the comments, I know that it's needed. I want to thank everybody, especially BlackDoctor.org, the producer, Ellis Dean, for having us and giving us this hour. It's not enough time, I can tell. But what I want to say is we want to we'll keep uplifting the families that are grieving, all of them, whether it's through domestic violence, gun violence, suicide. We're going to keep uplifting the people who were affected, who are still left to grieve. And like Dr. Higgins says, the hole in your heart is because they gave you so much love. But we also know that unfortunately, part of life is death. And we do have to get to acceptance. And we know that that's the cycle that's in the grief cycle. So for all of us that are grieving now, we pray that you get to acceptance. We pray that you find healing. And just know that BlackDoctor.org, My Uzima, Rodham Institute, Dr. Higgins' practice in the Bay Area, Houston, Dr. Bailey at his institution, and Dr. Freeman is working with our military families, that we are all out here to support you. So we thank you. Is that it for us, Dr. Gigi?
I'd like to end by thanking you, Dr. Kendra Outler, for really bringing this incredible panel together and talking and discussing this issue, which impacts all of us. We didn't even talk about how people who are witnessing the violence, maybe not directly impacted by it. So all of us could have benefited from this talk. And thank you for the guests. Thank you for our guest host, Dr. Outler. And please visit Uzima. She's got an incredible website. And we all wish you well. Happy New Year. May it be filled with joy, health, happiness, and safety.
All right.
Take
Thank
care and
you.
see you next
Thank
year.
you.
Bye-bye.
Bye-bye. Happy New Year.
Good job. Happy New Year.